Pop quiz for you. What is the earliest that you can start to see signs of heart disease? Maybe in your 40s or your 30s? As a matter of fact, the answer is very shocking, but it's as a baby. In mothers with a condition called familial hypercholesterolemia, which is a genetic condition in which cholesterol levels are very, very high, autopsies in those who have died with this condition while they were pregnant have shown that the babies that they were carrying had fatty streaks in their coronary arteries, which is the first signs of heart disease in the womb. And this is a common misconception. Heart disease starts young. Today, I'm going to help you understand exactly how a heart attack starts from a tiny LDL cholesterol particle to a plaque to an eventual rupture or stenosis. Stay tuned. So like I said, plaque usually starts building long before we ever feel anything. In the Bogalusa heart studies, children and teenagers were followed throughout their life and were monitored for things like weight and cholesterol and sugar and different risk factors that lead to heart disease. Now, some of them tragically passed away young due to things like accidents, but what was found on their autopsies was very, very shocking. Many of these teenagers, seemingly healthy on the outside, not significantly overweight, had atherosclerotic plaques and fatty streaks in their arteries already. And this is, of course, something that they would have never known and their doctor would have never known by just looking at their routine labs. And this is true later in life as well. Many times we don't see any sign of heart disease until that last percent buildup that's been accumulating for decades and decades that leads to something like a heart attack. And this is really a tough thing for me in the office. A lot of times I am trying to stress the risk of heart disease, and patients will say that they feel fine, there's nothing to worry about. A lot of them are athletic and not significantly overweight or anything like that. And I'll actually do something called a calcium score, which looks for calcified or late stage plaque on their arteries. And not infrequently, that number will be incredibly high, even when they feel perfectly well. So how do we get here? Where does this begin? So I'm sure you've heard of a lab value called your LDL cholesterol. This is a lot of times called the bad cholesterol, and it stands for low density lipoprotein. You could think of it like a submarine. Inside of the submarine is cargo, which is the cholesterol. And this is really important because it's used for all different kinds of purposes in your body, making cell membranes, making different hormones, things like that. Now, the protein part is the actual vessel, the submarine, that helps that cargo travel through your bloodstream. And so this submarine is traveling in different channels that are a lot like your blood vessels. You could think of these channels as having barriers on the sides of them, kind of like an underwater fortress that it's traveling through. Now, this barrier keeps things out that shouldn't be there. And this barrier turns out to be very, very important. So the endothelium is the inner lining of your blood vessels. It's only a single cell layer thick, but it has a really, really important purpose. Keep things out that should not be there. Besides just being a physical barrier, they do a lot of really interesting things. They regulate what goes in and out of the inner lining, things like electrolytes, and they release substances to help expand your blood vessels, keep them from getting really hard and inflexible. Now, sometimes these little submarines will be floating along and they'll just kind of bump into the fortress wall, and they'll actually slip through into the other side of that wall. And once an LDL gets through that artery wall, it triggers your immune system to get involved, and this is where things can get really bad. So the story takes a turn for the worse when your immune system gets involved. Once LDL particles push through this barrier, it's now in a restricted area. It's like there's a foreign environment there, and particles like this were really never supposed to be in this area. It's like that submarine just broke through this barrier into a room filled with caustic material that can cause something like an explosion. Now, your body, specifically macrophages from your immune system, are patrolling the area, and they try to control the situation by swallowing this LDL particle. Now, if this doesn't work, more macrophages show up and try to get rid of this plaque as well. These macrophages fill up with cholesterol and become what we call foam cells because it looks like foam under a microscope. Now, if you add many years to this, now you have a very large plaque and your body is really concerned. It's clearly not doing a very good job of getting rid of this plaque, and so it has to do something drastic. So in a last-ditch effort to have this artery try to stabilize this plaque, it tries to lay down scar tissue and calcium, sort of like it's pouring concrete all over this plaque and just hoping that nothing will break through. But unfortunately, if there's even just a small weakening or a soft spot or any number of other things, the plaque can rupture and cause a heart attack. The other thing that can happen, of course, is that this plaque just continues to build and no blood is able to get through, and eventually that can lead to something like a heart attack. But really, this is not an overnight episode. This is something that's happening in the background for many years. And if you think about it, a heart attack isn't just one moment when that plaque ruptures. It's a record of every LDL particle that has passed through your bloodstream. Every day, every year, every meal, and your arteries remember all of it. Now let's turn to someone who's had a very unusual heart. One that, as we'll see from his autopsy, shows us the key to avoiding a heart attack. Clarence Demar was a lifelong athlete, and he was really extreme. He would often run to and from his work at a print shop for 14 miles a day. And he was an absolute freak about running, and he was a really good runner. He won the Boston Marathon, which, if you're familiar at all with running, is a super prestigious race. He won it 7 times, and he's competed in the Olympics throughout his life. Now, Demar tragically died of cancer at 70 years old, but the autopsy of his heart did show something very interesting. The autopsy report, which is published in the New England Journal of Medicine in 1961, revealed that the arteries of his heart were freakishly large, 2 to 3 times the size of a normal artery. And this is key. Demar's autopsy did show that he had plaque buildup in his arteries, but because his arteries were so large, they weren't getting clogged. So this is an example of arterial remodeling, also known as athlete's heart. It's when the arteries of the heart are enlarged. When you exercise, there's this kind of shear stress that's pushing against that endothelium, that inner lining of your artery, and it's stimulating things like nitric oxide, which help your arteries open up and stay flexible. Doing what you can to preserve the lining of your arteries is super important. Keep your blood sugar low, keep your blood pressure low, and keep exercising regularly. Want to know which labs you can get checked that would predict heart disease years before symptoms start? Check out my next video here. And thank you guys so much. Take care.